Greetings, everyone. I'd like to introduce you to my friend Greta. I think you may have seen us hanging out together before, creating some previous videos. I hope all is well wherever you are at whatever time of day it is. And today we get a chance to talk about what, G? What are we talking about today?
Health promotion in the best way possible.
Health promotion in the best way possible. G, can you, as we navigate through this little educational video, what's important for you as it relates to health promotion in the best way possible? What's important for you that you'd like to share with the viewer?
Well, I've got a lifetime of learning behind me, and I've been wanting to do health promotion all my life, although it's not the place where the jobs are available usually. We can work in surgery, or we can work in outpatient, or we can work on medical floors, and we can work at public health. Maybe there's a little bit of health promotion, but even there is not that much. And it's been my passion, I guess you'd call it, for a while. The fact that instead of always treating sickness, we should be trying to prevent sickness and disease and all kinds of social issues, which often end up in the hospital.
So what I'm hearing, what's important for you is to be able to take some of that health promotion that you've wanted to do for your lifetime and got a few years underneath your belt.
Oh, yes.
In life, and now want to be able to promote health through a platform like today, sharing it through this little video. And I'm hearing that you want to be able to maybe focus more on the health and some of the things to consider. I notice you have a little diagram or a little item in your hand.
Well,
Please share.
This is something that I learned way back in 2002, 2003, and it's called the Circle of Health. It was developed in Prince Edward Island, and it's now the property of a business called the Quaish. But the diagram is so useful because it's also made in such a way that you can move it around and look at the part that you want to look at. And it's based on some of the most important things that we've been doing, Darren, because the first part of it, the wine part, is called the values. Then you have the social determinants of health. Then you have the, the who, what, where, and how is all there. And it has that 4 parts, which was so important to me that I used it when I did my emotional fitness training, because it's got 4 quadrants. And they are the emotional, spiritual, mental, and physical aspects of health. And I actually used this when I did my presentation for EF. And way back when. And, yeah. Anyways, it fitted with my beliefs that in order to be helpful, really helpful in health promotion and prevention of disease, we have to look at what I call the social determinants, or the health determinants of health, the determinants of health, or the social determinants of health. So it was started with a group from PEI, and they actually got some help from the Mi'kmaq population to develop this. And as you probably realize, being that you have native blood, is that it looks a lot like the wellness wheel or the circle of health that is used by our native populations. And I think that was probably one of the things that drew me to it, because it made so much sense. And I was really, how would I say, questioning myself as to what was the difference between mental health and emotional health. because I hadn't thought of that before too much. I mean, it was there somewhere, but it wasn't at the top of my list of concerns. But when I started looking at it, it made so much sense that what we call mental health is up there, as we know, and what's called emotional health, where is that? And I thought to myself, well, it sort of seems to fit in the guts. And of course, right now we're finding out that's exactly what's happening with emotional fitness, that they're discovering that a lot of what we have, which we call reactions, hits us in the guts. And so it's important. And because in emotional fitness, we've been talking about trauma and things that we can't seem to let go and things like that. And I have also had issues of that sort in my life. And so it really hit home to think about the fact that some things I just didn't seem to be able to let go. And of course, having been trained in choice theory and reality therapy, I realized that, are we really, really addressing that or not? And then I thought, well, it looks like it's that lightning piece there that's on the chart where we get a reaction of some sort happening. And are we addressing it? Because for some people, it becomes the most important aspect of what they need to do, which is to look inside and to see what has happened that may have caused me to have fight, flight, and freeze. Freeze was the part that got to me, in that I have felt blockages along the way. So yeah, that was part of it. But also, what is it that has happened in my life that may have led me to be frozen or in flight or in fright? And that's where the chart comes in very handy too, because it's got all the social determinants in the blue part. And I started looking at that and I thought, my physical environment, my healthy development as a child, my gender, oh my, that was a conditional thing for me that I grew up with, wondering that being a woman, was that going to be a hindrance in my development? And then my support, my social support network, my mother, my father, my teachers, my priest, my friends. That's my social support network. Was that adequate? Did it fill my needs? And I can say not really. And then my education. Well, I did put a lot of emphasis on that one for sure, because that was supported by my parents. And employment versus unemployment, that's important too. I mean, right now we're talking of a whole bunch of homeless people in the city of Moncton, and I know that even if they were to find a job, most of them wouldn't make, or many of them wouldn't make an adequate income to be able to pay for an apartment and quality food. And so, wow. So I started looking at that some more, and I thought, well, geez, all these things fit together. That's why they were all put there on that circle, and you can circulate them around and look at each one of them and see what effect it has. And then this week, as I was thinking of maybe doing this interview with you, I decided to look online to see whether the social determinants of health affect people to the point that they might choose suicide. And I thought, oh my, I bet you they do, but I don't have any proof. So maybe I should look it up. So I did. So I went online and I said to myself, okay, do the determinants of health affect tendency for suicide. And I found a lot of stuff. Yes.
You found a lot of stuff.
Yes.
Can you share what that stuff looked like?
Well, I went, first of all, I ended up on the CDC, which is the, oh my God, the American site that does research on that subject. And I also ended up on the Canadian site that does research on the subject. And the first thing that came up was what might affect the tendency for a person to want to suicide. And it said stability of income. And I thought, oh my, we know that the homeless and people that are living in poverty in the city of Moncton and everywhere else really are lacking in their income to meet their basic needs. And I thought, oh yes, that is so true. I guess I was right in thinking so. And housing and transportation and having education of their own desire. You know, sometimes we push people to university, sometimes we say you can't do that, and sometimes we say you should do that. And well, I believe that education be as to one person's desires and abilities. Are we really promoting education according to desire and ability? And I could answer, no, we're not. And when I asked myself, are we providing people with housing that meets their needs? And I could say, no, we're not. And I've known that for a while because when I studied at first in the 1960s, that's quite a while back, we were addressing Maslow's hierarchy of needs. And at the very basic level was housing, food, clothing, transportation, income, basic needs. And then you can only teach people skills when their basic needs are met. And I keep trying to tell that to my community, that we're wasting our time with Band-Aid solutions and we're not addressing those basic needs. I mean, there are a few people that are now trying to get that implemented, the basic income according to living, you know, needs. In other words, $12 an hour, definitely not enough. The St. John Human Development Council has done this analysis a number of times. And last time I looked, they said that you needed at least $18 an hour in order to meet your basic needs. And that was last year. So right now it's probably higher than that. So what are we doing? We're doing, oh, we'll feed them at the food bank. Oh, we'll give them the House of Nazareth or whatever else is available in town as it's called a shelter, I guess, or a crisis shelter. Well, what are we doing to really address the needs? And I'm not blaming the House of Nazareth. What I'm saying is that as a society, and it does say so on this little chart, as a society, we need to address the basic needs before we can get people settled into a life that makes sense. Wow. Of course, we can't address everything. I mean, there are people that are born with emotional or mental handicaps that can't be resolved. But that's not the majority of the people. The majority of people that are in need right now, from what I can see, and I'm just one person, are people that have given up or have never been able to get into the circuit, I guess I would call it, of living an adequate life. And of course we know, and that's also addressed on this chart, we know that we're creating needs in many ways from the business world, from industry, for people to have, I don't know, not an 18-wheeler, but a 4-wheeler with all kinds of gadgets, which costs about $50,000. While what we need is transportation. You know, we don't need that big car, but we're creating that need. When we put a man online and he's doing adventurous things, where do we see him? In a 4-wheeler out on the mountain or out on the beach, and he's revving and, you know, doing all kinds of probably nice things, which you could do by walking to the beach, because we live close to beaches all over New Brunswick. So what I say is that industry is creating needs, and industry also has to take responsibility. And healthcare is saying we need to eat beautiful fruits and fresh vegetables, you know, all this sort of stuff. But do people have the money to buy this? And how are they going to provide for themselves to respond to their needs? So I think that the circle of health tells us that, you know, society, systems, communities, families, they all need to be involved in creating the answer, or to create what I want to call health promotion. So I think that what I'm trying to say more than everything is that we need every hand on deck. We need everybody to be involved. We have to stop saying it's their fault or it's their responsibility. It's my responsibility. It's your responsibility. It's the responsibility of everybody in the community, which includes priests and ministers and politicians, medical doctors, lawyers. Everybody has to get on and of course, we must make sure that we involve the people that are suffering the most. I mean, if we decide as people that have education or as people that have money, what to do for them, we're missing the boat. We're missing the boat. The people that are needy need to be involved in finding the solution. And in fact, as we know in emotional fitness, they're the most important people. The ones that are suffering are the ones that need to look at the situation and propose their own solutions. So to me, emotional fitness, reality therapy, Rogerian therapy, all kinds of therapies, including system work, which is what this is, because we're trying to change the system, needs everybody to be involved. And the people that are suffering the most have to be the ones that are most involved and tell us stuff. And we have to learn to listen.
So if you don't mind if I give you back some of the things I heard so far. So I heard that the importance of the determinants of health, or the social determinants of health, is very important, and that there is a connection between the social determinant of health and people who are experiencing struggles and challenges, including those who may pass through suicide. And that's a progressive stage. I also heard about mental health and emotional health and the different tools that we have available to support ourselves, and that these struggles and challenges that we may see within our communities is a complete community responsibility with all hands on deck, and that we must all play a role to support one another and move our communities forward. Recently I've had a number of different individuals reach out to me, and I hear often the terminology around, I have to go see a mental health professional. I have to try to go see somebody dealing with a mental illness. I have to get in to see a psychologist or a psychiatrist. And Greta has an extensive background experience in mental health, suicide prevention committees, worked with psychiatric units,
Mhm.
has been trained in choice theory, reality therapy, emotional fitness, and the list just goes on in terms of your incredible
And
comprehensive
some of
background
this.
experience and some of this.
Yeah.
So what would you offer or suggest the viewer today, that if somebody in their life is going through struggles and challenges and are saying they can't get in and get help, they can't get into the mental health professional, they can't get into the hospital, there's no beds,
Or
so
they
on and so
can't
forth,
afford it.
or they can't afford it, based upon your knowledge of social determinants of health and your background experience, what would you offer that mom, that child, that family member, that friend who's saying, I've got somebody in my life who's going through some significant challenges. What are a couple things I can do to either help myself and or help someone else? And it might not necessarily be involved in trying to get access to a service where there's a long waiting list or there's no availability. What would you offer them based upon what you shared today, determinants of health, and some of your other innate wisdom and experience?
It's not easy.
I know it's a tough question. Sorry to put you on the spot.
No, that's all right. I love what Dr. Glasser suggests in his book about mental health can be hazardous to your health or something like that. Psychiatry can be hazardous to your mental health. What he's suggesting is that we need groups, support groups. And at the beginning of such a group, either someone who's trained like myself or someone like you can be there to help start the group off. But soon within the group, there's the strength. The strength is found. I can see that that person might be able to help me find a lodging, or that person might be able to help me find a job, you know. So, and Dr. Glasser is not much of a believer in medication. And I'm not fully in agreement with him, but I understand that if we are able to intervene early enough, we might be able to prevent a lot of mental illness. And I did see at least one case where the psychiatrist intervened when the child was about 13 or 14, and that child is relatively functional and has a job today. So let's not run to the medication. I've always felt, and as a nurse, I was told I should always get a second opinion. So if somebody wants to prescribe a medication to me, and I know right now we're having issues with doctors and nurses and all that, but I would like to get a second opinion. Because when it came time for me to have a hysterectomy, I said, no, not tonight. Maybe in 2 days when I've had a consultation with another doctor. And I insisted on that because it was part of my body. And I did get my consultation and I did decide to get my hysterectomy. But nowadays they might not suggest a hysterectomy because we've got new treatments for endometriosis, which is what I had. So I guess what I'm saying is, especially now, if you're able to speak to a nurse or a psychologist or a social worker or a family member with experience in the field of some sort, maybe get your second opinion before you decide to accept medication. Because we know that medication has side effects. We know that most of us, if we start on those medications, and I'm one of those, we end up taking them for the rest of our days. And if you look up medications online, and most people are on the web these days, you'll see that there's side effects that you may not desire. And so, and they may be side effects that are dangerous to your health. So what I mean by health promotion and prevention is you're the person who's responsible for you ultimately. If you're able to do your research, get some support to do your research, and if you need a group of support, you might want to create one yourself. I mean, I went to emotional fitness because I felt the need. as you did and take. And it has helped me a lot. And I see a lot of recent literature that says that for depression in particular, or anxiety, there may not be a need for medication. What people need is skills to be able to find their own solution. And I've got books on the subject, and it's so fascinating because I still use them because I do have a tendency to anxiety and depression. And I use them on myself, and I have done some self-help things, such as we both know, my plants, which are a part of my day, and going for walks, listening to good programs on TV, choosing them well, and reading, and doing some exercises, physical and mental, to change my attitude. Because if I start feeling depressed, I can't stop myself in many instances. And so I think that all of us can be much more self-helping than we give ourselves credit for. But, and I absolutely insist, basic needs must be met. That's why I support basic income. That's why I support teaching, learning, experiencing new skills, good availability, and taking in quality foods, having a place to stay. These are the most important things that I can do for myself. And I suggest them to others because it works on me.
So something I heard, and we'll wrap this up for this time, but we'll be back. We'll be back.
Okay.
I guess we're going to be back. So if I had to kind of summarize the essence of today, it is about all hands on deck. It's a community responsibility. We all play a role, but most importantly for ourselves as individuals, taking responsibility and making sure we have our hands on the determinants of our own health, and making sure that we're addressing the different things you mentioned earlier, G. And I had heard kind of basically a call to action, or things that we should maybe consider to put in our individual action plans going forward. Any final words?
Yes, Darren. I must say that the social determinants of health are extremely important. We cannot teach anybody any skills unless they have a roof over their head, good food in their gut, and a social support network of some sort. So these are extremely important things. And I think that when we forget to implement those, we're just putting band-aids on issues and not addressing them. That's my final say.
That's Greta's final say, and I'm looking forward to the next sharing, where we'll get a chance to have Greta back to share some additional innate wisdom and experience with an incredible diversified background. And Greta's contact information is below in this video. Please feel free to reach out to her. You don't mind people reach out to you?
By email, no phone calls. I don't
By
answer
email.
most of them. They're only scams.
So by email, Greta is willing to respond to some of the questions that you may have. I'd like to thank everyone for taking time in your schedules to join us, and we will see you next time.
Thank you.